Who needs a booster shot, and when will they start being rolled out?
Booster shots are recommended for individuals who have moderate to severe immune compromise, and that's going to include folks who've had an organ transplant, like kidney, liver, heart, lung. That's going to include people who've had a bone marrow transplant within the past 2 years, patients with HIV that are not under good control. That's going to include patients with some autoimmune diseases that are on biologic therapies, like Crohn's disease, lupus, things like that.
Aaron's knee is sore. I'm old. Do we need the booster?
Not at this point, no. The immune compromised are we'll go back to first tier for boosters because they're at the highest risk. They're the ones who are much less likely to respond to the vaccine, sometimes at all. And so we want to, and what we've known for years with other vaccines is that most immune compromised people need 3 doses to get a good response, whereas everybody else needs 2. So you guys are okay for now. And it's likely that the next tier in a few months, maybe, will be folks who are older than age 65 or 70. So we'll go back to an age criteria. And then probably after that will be folks who got Johnson & Johnson vaccine because we know it's not quite as effective as the others.
The Pfizer, the Moderna, the mRNA vaccines, the Johnson & Johnson, the more traditional. The booster, is it for all 3 of those? And is it an mRNA booster, unlike the original Johnson & Johnson shot?
The boosters that are recommended are either Pfizer or Moderna mRNA vaccines. It's the same vaccine, same dose, same everything, just like getting a second dose, you're going to get a third dose of the same thing. And we're only using the Pfizer and Moderna as boosters, not Johnson & Johnson. You know, the J&J is not as effective against the Delta variant. So right now, there's not a strong recommendation for getting the Johnson & Johnson.
Is the booster just a shot of the same thing, just the same thing as the Pfizer or Moderna, just a third dose?
Yep, exactly.